Hi, Brandy. My name is Guillermina Rojas, nurse practitioner. I will ask you some questions and I will perform a physical exam later. Have you ever had a head injury or a recent fall? Do you feel unsteady when standing or walking? Are you worried about falling? Do you have any tremor or shaking in your hands? If so, do they occur more during rest or during activity? Have you experienced any weakness, numbness, or tingling in your extremities? Have you noticed any issue with your balance or coordination? Do you ever get dizzy or lightheaded? If so, does this occur as a result of activity or a change in position? Have you noticed any change in your ability to move around or participate in usual activities? Do you have any chronic disease like high blood pressure, myasthenia gravis, multiple sclerosis? In your family, has any ever had a stroke, seizures, tumor in brain or spinal cord? Have you had changes in your ability to perform personal care? Do you drink alcohol? Have you ever used recreational drugs? Do you use seatbelt? Have you ever injured your head or spinal cord? If so, what changes have you experienced since injury? Have you had surgery on your brain, spinal cord, or nail? Have you ever had a stroke? If so, what changes have you had as a result of stroke? Do you have a seizure disorder? If so, how often? What do you do to prevent seizure? After all the data collected, one of the possible diagnoses could be vitamin B12 deficiency. A diet low in vitamin B12 can cause vitamin B12 insufficiency. The most common cause of vitamin B12 deficiency anemia is a lack of a chemical known as intrinsic factor, which is created when your immune system attacks the stomach cell that generate this factor. Pernicious anemia is the name for this form of anemia. Pernicious anemia is more likely to occur in those who have endocrine-related autoimmune illnesses such as diabetes or thyroid disease. For diagnosis, I will order blood work to check the blood level of vitamin B12. For treatment, I will recommend a diet rich in vitamin B12, which is found primarily in meat, egg, and milk. Also, vitamin B12 injection or vitamin B12 pill orally are advised for the treatment of pernicious anemia. You may have shot every other day initially. Eventually, you will only need shots once a month, and depending on your circumstances, you may need them for the rest of your life. Differential diagnosis: thyroid disorder. Ataxia can be caused by hypothyroidism or hypoparathyroidism. Infection with COVID-19, ataxia is a complication of this virus that occurs most frequently in the most severe patients. Okay, thank you so much.